At the Brandywine Health Foundation, we understand that health can be unequally influenced by income, education, ethnicity, and where a person lives. And so, we've consistently taken a broader approach to addressing the factors that influence health. Since our inception in 2001, we have granted over $16 million to nonprofits addressing health equity, healthy youth, and healthy community issues, as well as nursing and college scholarships for our area youth and young adults. In addition to distributing grants and scholarships, the Brandywine Health Foundation's public charity status allows us to raise additional private, public, and government grants that have enabled us to do so much more, including working within the Coatesville Area School District and other community partners to bring the Youth Mental Health First Aid curriculum to Coatesville. Our Youth Mental Health First Aid program is a public-private partnership established to improve the behavioral health status of children and teens in the greater Coatesville area, one of Pennsylvania's poorest communities, and one in which teens report feeling sad or depressed at rates disproportionately higher than the rest of the county and state, according to the Pennsylvania Youth Survey. In 2014, the Thomas B. Scattergood Foundation initiated this 4-year pilot program with the Brandywine Health Foundation, and they've been our lead funder for this program.
So the Scattergood Foundation's partnership with the Brandywine Health Foundation started with a conversation with their CEO about her concerns that the Pennsylvania Youth Survey was showing increases in depression scores in their 8th and 10th graders. And at the same time, they were beginning to see a decrease in utilization of children and adolescents accessing behavioral health providers in the Coatesville area. As part of that conversation, we suggested a community-based strategy for looking at mental health and substance use issues across the school district. So we suggested looking at mental health first aid as an approach.
The program is working to create a support system within the schools and in the community that is respectful and sensitive. A system that enables youth to access quality behavioral health and mental health services in a coordinated manner. The Youth Mental Health First Aid Program and the Brandywine Health Foundation are doing just this. We feel that everyone should have the opportunity to achieve optimal health and well-being.
Our project also received a jump start when the Coatesville Area School District was chosen as just one of 4 Pennsylvania school districts among 119 state and local educational agencies to be a part of a major national initiative to support teachers, schools, and communities in recognizing and responding to mental health concerns among youth through the MHFA program. Our school district received a $100,000 grant over 2 years to support the implementation of YMHFA here in the greater Coatesville community. These funds enhance private funds that the Brandywine Health Foundation secured to implement and run the program through 2018.
So 3 years into a 4-year initiative, we have 10 funders supporting this project across the school district. We've seen increased collaboration of the school district with the County Office of Mental Health and Substance Use and with the child and adolescent providers across the Coatesville area.
The total program cost is approximately $600,000 over 4 years, and our funding collaborative includes numerous private foundations, individual donors, and community organizations, as well as county, state, and federal funding.
Hi, I'm Kim Bowman. I'm the director for Chester County's Department of Human Services, which oversees a number of our agencies, county agencies, that work with children and families all the way from birth through the senior population. So we're pleased to be asked to partner or be part of the collaboration, and the public-private partnership was very appealing. The prevention aspect, the early intervention is exactly where we want to be to move things upstream. And I think this also helped jumpstart a much broader community-based, beyond the Coatesville area, mental health first aid effort, so that now I think there's been, the Brandywine Foundation's efforts are closing in on 1,000 individuals trained, and then we have another 1,300 or so that have been trained around the county, including now into some specialized trainings for law enforcement for older adults. So there's been benefit, not just tremendous benefit in the Coatesville area, but also the county as a whole.
The program does not ask for them to make a great deal of technical intervention, so they don't have to be trained to the level of mental health therapists. The group only asks that these people know this teenager, notice the difference, reach out to them, and get them to places where they can get adequate care. So it's an easy decision to support the program with money from the foundation. Thank you.
We truly believe the key to securing funding for our Youth Mental Health First Aid Program is to illustrate the need, and the key to our continued funding is the expert evaluation at the Westchester University School of Public Health is providing. Outcomes matter. Numbers matter.
So the Scattergood Foundation is very excited to hear the findings from the evaluation that's being conducted by Westchester University. And what's exciting is that the early findings are showing an increase in knowledge and a decrease in stigma. And we at the Scattergood Foundation strongly believe that overall community well-being will be a function of communities that can decrease mental health and substance use stigma and increase knowledge about how does one get to the care they need.
We are so pleased to be a partner in funding the Youth Mental Health First Aid Program that was initiated and brought to our community by the Brandywine Health Foundation. We find that in all of the programs that we fund here at United Way, that people are encountering problems with children having issues with behavioral health and mental health. We believe that the Youth Mental Health First Aid Program will go a very long way to cutting into that. We hear stories of bullying, children having severe depression, and even committing suicide. Our community can't stand by and let that happen. This program is a very efficient and very effective tool to combat that. We're very pleased to be a partner of this work.